Hello, back again with another episode of Real Health Talk with Dr. Coring. For those who do not know me, my name is Dr. Coring. I am a board certified internal medicine physician and now training to be a hematologist and or oncologist in fellowship. And it is my pleasure as well as my passion to educate common folks such as yourself about health topics that affect you or can affect you on a daily basis, essentially to keep you well. I am passionate about wellness. I'm passionate about educating patients and improving health literacy. And so today I would like to discuss, especially since it's becoming fall and the weather is changing. I would like to discuss respiratory infections and preventing COPD exacerbations by reducing respiratory infections. Especially for people with COPD, I think this episode would be very important. And so I would like to start off by saying COPD exacerbations or flares, 10% of these problems are caused by RSV. And what is RSV? It's a respiratory syncytial virus. And so RSV causes about 10% of COPD flares. And we could prevent these flares within our COPD patients just by vaccines. And so we can use and administer the RSV vaccination to help prevent these flares. And there is a vaccine available. It's an mRNA vaccine that's available that have been proven to be safe and effective at preventing COPD exacerbations and flares. So let's talk about RSV for a minute. As I mentioned, it is a respiratory virus that spread through contact with droplets from an infected person's nose and throat, or just by touching a surface that has the virus on it from an infected person. And so it's very contagious, and it's most common, again, like I mentioned, in the fall, winter, and spring. And so people with RSV are typically contagious for 3 to 8 days after they have been exposed. However, some infants and people with weakened immune systems, however, can spread the virus for up to 4 weeks. And so it's important to avoid, or even it's important to prevent spreading the RSV virus if you can. And so it's typical that we recommend people wash their hands, often cover your nose when you're sneezing or coughing, standard things, avoiding sick people. These sick people, like I mentioned, with weakened immune systems, they can spread the virus for up to 4 weeks. So trying to stay away from sick people is very important. Cleaning and disinfecting surfaces are very important because, like I mentioned, these viruses can live on the surface, and you just by touching a doorknob and putting your hand in your face and your nose, you can potentially get infected with the virus. And so it's important to also stay home if you are having symptoms to prevent spread. Wearing a mask in indoor public places are very important. And also staying up to date on your vaccines will help prevent spread and or getting infected. And that's kind of what I want to talk about. And so the thing is, RSV, like I mentioned, is very contagious, and it's certain patient populations that are at higher risk for basically developing significant morbidity, or essentially what I'm trying to say is getting really sick if they are and or infected with the RSV virus. And so specific patient populations like older adults, young children, people with weakened immune systems, also people with just chronic diseases like COPD, heart failure, people who smoke, chronic smokers, people with lung diseases like interstitial pulmonary fibrosis, COPD, people who have been affected or are infected by HIV. These patient populations are at higher risk for not only being infected with RSV, but also are at high risk for becoming really sick if they are infected with RSV. And so, therefore, I would like to spend the remaining time discussing our COPD patients because, as I mentioned, COPD exacerbations are typically 10% of these exacerbations are typically caused by RSV infection. And so it's very important that people with COPD get vaccinated to prevent these RSV infections, which would in turn prevent COPD exacerbations. And so let me talk briefly about what is a COPD exacerbation. I think it's very important to understand what it is so you can recognize it if it happens. And so it's typically a flare of COPD. So you already have the diagnosis of COPD. You already seen your pulmonologist and have been diagnosed with COPD. People with COPD likely are smokers or was a smoker. And so you have a history of smoking. Now you're diagnosed with COPD. You're taking inhalers to prevent any more worsening issues, to prevent exacerbations. You have the diagnosis. Now, what is an exacerbation once you have been diagnosed? Well, basically, there are some criteria that have to be met. Increased cough, and the cough should be productive. So an increased productive cough, meaning you producing sputum. It could be white sputum, it could be clear sputum, it could be yellow sputum. God forbid, it could be green sputum, which would probably indicate infection, likely would indicate infection. Basically, increased cough with increased production of sputum. And also increased shortness of breath as well. And then also you may notice you becoming more hypoxic. You test your SpO2 and you realize your oxygen levels are not where they once was. And if you are already on oxygen at home, you notice you have to increase the amount of oxygen you need. So maybe you were on 2 liters of oxygen at home. Now I have an increased cough, I have increased sputum production, and now I'm noticing I need more oxygen than I once required. So all of these can be signs and symptoms of a COPD flare and or COPD exacerbation. And it's interchangeable. We use the word exacerbation and flare interchangeably. And so 10% of these problems, so 10% of these flares is typically caused by RSV. And so the problem with the flaring is we worry about pneumonia. And so people typically who have a COPD exacerbation and or flare typically will worry about infection. You now are at risk of developing a pneumonia. And so that becomes really concerning. And or you probably would need to go to the hospital and get admitted. And once admitted to the hospital, you are now even more at risk of developing a pneumonia, typically hospital-acquired pneumonia. And so getting and going to the hospital can also put you at risk for infection. And also with these COPD flares, you are at risk of being intubated, meaning being connected to a breathing machine, a ventilator, for respiratory or lung support. All said, we don't want this to happen, right? If 10% of the COPD flares is caused by RSV, and we could reduce this risk factor by basically vaccinating, essentially because it's been shown that providing the RSV vaccine has been shown to be safe and effective, especially for our COPD patient population. And which leads me to the next and final point. Who should get vaccinated? Who is the vaccinated good for? Well, obviously, people who are at risk for RSV. And I went over the list. I'll go over it again. Older adults, younger children, people with weak immune systems, people with chronic disease, such as COPD, heart failure, chronic smokers, people with lung disease, such as COPD, interstitial lung fibrosis, asthma, and also HIV patients. And so, obviously, if you have COPD, you have the risk for developing RSV, which will in turn allow you to have a COPD exacerbation, which means that the vaccine is perfect for you. However, the mRNA vaccine is specifically designed for people who are older than 60 years of age. And so let's make sure that you're older than 60 years of age. When getting the vaccine, it's only one single dose. So once you're vaccinated, you don't need to get vaccinated again. And in fact, it's a contraindication. So if you previously received RSV vaccination, it's not recommended to receive another dose. It's an intramuscular injection. Um, Adverse reactions, you may get some pain at the site. You may develop some fevers, chills, headache, also some joint pain. That's been common. Less common, nausea and vomiting. It's less common. And if you have anaphylaxis to any component of the vaccine, it's pretty much not for you, obviously. And also, something to make note of, it's been said that if you have a bleeding disorder, such as thrombocytopenia, you get hematomas in your joints, you may want to ask your healthcare provider before considering getting this vaccine administered. But overall, generally speaking, it's a pretty well tolerated vaccine. People with immunocompromise, so if you're undergoing chemotherapy or you're on high dose steroids, um, it's really not a contraindication for you. However, you may not get the robust response to the vaccine once administered. Simply saying the vaccine may not work for you because your immune system is already low, and the vaccine really is designed to give you immunity to the RSV virus, but your immune system actually have to work to provide you the immunity that's required, essentially. And so just to make note of that. But overall, this mRNA vaccine is generally well tolerated. And if you, excuse me, if you have COPD and you're over the age of 60, I highly recommend you consult with your primary care provider, your healthcare provider, and or your pharmacist to see and assess your eligibility for the vaccine, because it really can reduce COPD exacerbations. It also can reduce hospitalizations. It can reduce pneumonia, other infections, simply by reducing these COPD exacerbations in hospitals, hospitalizations. All right. So that's my time, guys. It's fall time. Obviously, it's approaching winter. RSV, is a contagious disease. It definitely causes problems. Sometimes it's hard to prevent it, especially if you're around little kids, because they are high spreaders of the disease. And so, therefore, it's a good idea to get vaccinated to prevent RSV infections. If you have COPD, to prevent COPD exacerbations, which will ultimately prevent morbidity and mortality. Essentially, it will prevent you from dying, essentially. All right, that's my time, guys. I love you. Peace and love. I forget to say all the time, please like and subscribe. I'm trying to grow my channel. I'm trying to educate people, prevent disease. This is what I like to do. This is my passion. So help me, encourage me. All right, peace.